Today, I will be talking about eczema. Eczema is a condition where patches of skin become inflamed, itchy, red, cracked, and rough. Blisters can also occur. It affects a large section of the American population to a lesser or greater degree. The word eczema is also used specifically to refer to atopic dermatitis, the most common type of eczema. In this movie, we will explain what eczema is and discuss the causes, symptoms, and treatments. Eczema is likely related to conditions that adversely affect the skin's barrier function, including genetic factors, nutrient deficiencies, bacterial infection, and dry, irritated skin. Certain foods such as nuts and dairy can trigger symptoms. Eczema can also be triggered by environmental factors such as smoke and pollen. Treatment focuses on healing damaged skin and alleviating the symptoms. For some, their eczema will eventually disappear completely, but for others, it remains a lifelong condition. The term eczema is used in two different ways. It can be used widely to describe any rash-like skin conditions. Or it can be used to describe atopic dermatitis, a chronic skin condition that commonly starts during infancy and continues through into childhood. Some people outgrow the condition while some people will continue to have it into adulthood. The word atopic refers to a collection of diseases involving the immune system, including atopic dermatitis, asthma, and hay fever. Dermatitis means inflammation of the skin. The specific cause of eczema remains unknown, but it is believed to develop due to a combination of hereditary, genetic, and environmental factors. Children are more likely to develop eczema if a parent has had it or another atopic disease. If both parents have an atopic disease, the chances increase further. Environmental factors are also known to bring out the symptoms of eczema. These include irritants, soaps, detergents, shampoos, disinfectants, juices from fresh fruits, meats, or vegetables. Allergens, dust mites, pets, pollens, mold, dandruff. Microbes, bacteria such as Staphylococcus aureus, viruses, certain fungi. Hot and cold temperatures, hot weather, high and low humidity, perspiration from exercise. Foods, dairy products, eggs, nuts and seeds, soy products, wheat. Stress, it is not a cause of eczema but can make symptoms worse. Hormones, women can experience worsening of eczema symptoms at times when their hormone levels are changing, for example during pregnancy and at certain points in their menstrual cycle. Atopic dermatitis commonly manifests itself in infants with dry and scaly patches appearing on the skin. These patches are often intensely itchy. The symptoms of atopic dermatitis can vary, depending on the age of the person with the condition. Most people develop atopic dermatitis before the age of 5. Half of those who develop the condition in childhood continue to have symptoms as an adult, though these symptoms are often different to those experienced by children. People with the condition will often experience periods of time where their symptoms will flare up or worsen, followed by periods of time where their symptoms will improve or clear up. Infants. Rashes commonly appear on scalp and cheeks. Rashes usually bubble up before weeping fluid. Rashes can cause extreme itchiness, which may lead to trouble sleeping. Continuous rubbing and scratching can lead to skin infections. There are many different types of eczema. This article will predominantly focus on atopic dermatitis. Other variants include: there are types of eczema. Allergic contact eczema, dermatitis, a skin reaction following contact with a substance that the immune system recognizes as foreign. Contact eczema, a localized reaction where the skin has come into contact with an allergen. Dishydrotic eczema, irritation of skin on palms of hands and soles of feet characterized by blisters. Neurodermatitis, scaly patches of skin on head, forearms, wrists, and lower legs caused by a localized itch such as an insect bite. Nummulorexema, circular patches of irritated skin that can be crusted, scaling, and itchy. Seborrheic eczema, oily, scaly yellowish patches of skin, usually on scalp and face. Stasis dermatitis, skin irritation on lower legs, usually related to circulatory problems. A doctor may refer a patient to either an allergist or dermatologist for further evaluation. They may also attempt to rule out other conditions that can cause skin irritations. This can involve the following tests. Patch testing. Substances are placed onto the surface of the skin to test for skin allergies. Skin prick testing. A needle containing a small amount of a suspected allergen pricks the skin to test for allergies that do not necessarily occur on the skin, such as pollen or food. Supervised food challenges. Foods are eliminated and then introduced into the diet to determine whether a food allergy is present. There is no cure for eczema. Treatment for the condition aims to heal the affected skin and prevent flaring of the symptoms. Doctors will suggest a plan of treatment based around a patient's age, symptoms, and current state of health. For some people, eczema goes away over time, and for others, it remains a lifelong condition. There are several medications that can be prescribed by doctors to treat the symptoms of eczema. Topical corticosteroid creams and ointments. These are a type of anti-inflammatory medication and should relieve the main symptoms of eczema, such as skin inflammation and itchiness. If ineffective, systemic corticosteroids can be prescribed. These are either injected or taken by mouth. They are only used for short periods of time. Antibiotics if there is an overlying bacterial skin infection. Medications to treat fungal and viral infections. Antihistamines that cause drowsiness are often recommended as these can help to reduce the risk of nighttime scratching. Topical calcineurin inhibitors, a type of drug that suppresses the activities of the immune system. It decreases inflammation and helps prevent flare-ups. Barrier repair moisturizers. These reduce water loss and work to repair the skin. Phototherapy can be prescribed to treat mild to moderate dermatitis. It involves exposure to ultraviolet A or B waves, alone or combined. The skin will be monitored carefully. There are some natural remedies for eczema. Neem oil and coconut oil are great eczema healers. Bentonite clay mask brings out the pus inside eczema blisters and makes skin clean. Washing face with a light anti-fragrance soap is recommended. Since a lot of moisture is lost, a light moisturizer with no fragrance works the best and moisturizes the damaged skin. A healthy skin cleaning, cleansing and masking is very important. The most important thing is to eliminate the allergy foods like gluten, dairy, sugar, additives, nuts and foods that are high in histamine. Also, a liver cleanse procedure must be performed once in a week. Keeping the damaged skin moisturized with drinking lots of water daily and flushing out the toxins is important. In more complex cases, you must know whether your eczema is coming from a leaky gut, candida disease, Hashimoto, fatty liver disease or some lack of nutrients like magnesium, iodine, calcium and selenium. Low vitamin D and low calcium levels in the body also contribute towards eczema. An underactive thyroid gland also causes eczema. For overall a healthy gut, eat foods rich in probiotics like yogurt, buttermilk, kimchi, kombucha and foods that contain healthy bacteria. Highly acidic foods must be avoided during the healing process. Avoid foods with preservatives, additives and artificial flavors. Have a good day.